Hi, welcome to the Agni Nursing Academy. At today's session, we'll start with a beautiful quote. Quote is, without hard work, nothing grows but weeds. If we are keeping anything goal in life means we have to do hard work for that. We have to do dedication for that. For reaching our goal, dedication and hard work is very important. If you are not doing the hard work for your goal, definitely will get failure in life. The weed meaning itself, it says weed meaning is laziness or failure. That's why to reach our goal, we have to do hard work. Definitely, you will do the hard work for your goal, and we'll start today's session with first question. First question on your display: a infant was born at 30 weeks of gestation and weighs 1.2 kg at birth. Which of the following is recommended initial feeding method? Option A, intravenous fluid. Option B, feeding by spoon and katori. Option C, breastfeeding. And option D is orogastric feeding. A child born or newly born baby born less than 28 weeks of gestation means 28 weeks of gestation means we'll give the intravenous fluid, because newly born less than 20 weeks of gestation baby rooting reflex, sucking reflex, and the swallowing reflex are absent in this baby. That's why we will give the intravenous fluid only. Option B, katori feeding or spoon feeding, or also we can call it as a paladi feeding. Paladi feeding. Feeding by spoon and katori or paladi will give 32 weeks to 34 weeks in between born babies, because these weeks in between weeks baby born, they're having little immature rooting reflex, but the coordination between the sucking and respiration, that's why we can give the feeding by spoon and palate. Third one is the breastfeeding. If newly born baby born more than 34 weeks of gestation, then we can give the breastfeeding, because after the 34 weeks gestation baby completely matured rooting reflex plus sucking and swallowing reflex, and the coordination between the sucking and respiration will be properly present. That's why we are able to give breastfeeding for the 34 weeks of gestation. And orogastric feeding will give the baby born between 28 to 31 weeks of gestation. In the orogastric feeding will give, because 28 to 31 weeks babies born, they are having absence of rooting reflex, and there will be the coordination between the sucking reflex and respiration will be not proper. That's why we will give the orogastric feeding. That's why answer for our question is, in the question asked 30 weeks of gestation. That's why answer for our question is orogastric feeding. Option D is the correct answer for our question, that is orogastric feeding. We'll see the next question. A 5-year-old child presents with fever, conjunctivitis, cracked lips, and strawberry tongue, and the peeling skin on fingers. Diagnosis. Option A, scarlet fever. Option B, Kawasaki disease. Option C, Stevens-Johnson syndrome. And option D is measles. We'll see about the scarlet fever. In the scarlet fever is caused by group A streptococcus, that is Streptococcus pyogenesis infection. Group A streptococcus. In the scarlet fever will be present, and strawberry tongue also will present, and peeling skin on fingers also will be present. But in the scarlet fever, conjunctivitis and cracked lips will be absent. That's why we are eliminating the option. We are eliminating the option A is we are eliminating. Option B, Kawasaki disease. We'll discuss about the Kawasaki disease. Kawasaki disease is an autoimmune disease. Autoimmune disease. See here, this is the assessment findings of Kawasaki disease. Cracked lips and red tongue. Before going to this image explanation, I will give the mnemonic for Kawasaki disease assessment findings. We'll see. Mnemonic. Mnemonic is crash fire. Crash and fire. We'll expand this mnemonic. Crash and fire. C indicates conjunctivitis. Conjunctivitis in the image shows red and bloodshot eyes is called as a conjunctivitis. And second one is R means rashes. In the Kawasaki disease, maculopapular rashes will be present and its rashes are painful and itchy. And that's why here they given rash involving full of the body is rashes. And third one is A means adenopathy. Adenopathy, especially adenopathy involves cervical lymphadenopathy. Cervical lymphadenopathy. Lymphadenopathy. And S means strawberry tongue. Strawberry tongue. And H means hand and feet swelling. Hand and feet swelling. F means fever, that is high grade. High grade fever will present in the Kawasaki disease. Okay. See here, and hand and feet in the strawberry tongue, in the facial changes, mucosal changes, red and cracked lips will red tongue and red colored cracked lips will be present in the Kawasaki disease, and high grade fever and red and swollen hands and red and swollen feet. These are the assessment findings of Kawasaki disease. Mnemonic is crash fire. That's why option B is the answer for our question. In the scarlet fever also, fever present and strawberry tongue will be present and peeling skin. But in the scarlet fever, conjunctivitis and cracked lips will not present. Option in the scarlet fever. Stevens-Johnson syndrome. We'll discuss about the Stevens-Johnson syndrome. Stevens-Johnson syndrome is caused by overdose of the drugs. We can call it as a type 4 hypersensitivity reaction caused by increased drug doses. Type 4 hypersensitivity reaction. Which drugs will cause Stevens-Johnson syndrome? Mnemonic for drugs caused by Stevens-Johnson syndrome means CLAPS. CLAPS. We'll see the mnemonic CLAPS. CLAPS. C means carbamazepine. And L means lamotrigine. And A means allopurinol. And P means phenytoin. And S means sulfonamides. These drugs will cause Stevens-Johnson syndrome. And assess the severity of this Stevens-Johnson syndrome. One score we will use that one. Curtin's score. Curtin's score. This score we will use for the assess the severity of the Stevens-Johnson syndrome. Now we will see the measles. The measles is also called as rubeola, caused by paramyxoviridae family. Caused by paramyxoviridae family. In the measles, mainly in the assessment finding, 3C will be present. 3C, that is cough, coryza means running nose, and another one is conjunctivitis. But in the measles, strawberry tongue will not present. That's why we are removing option D also, measles and Stephen Johnson. Answer for our question is option B, that is Kawasaki disease. We'll see the next question. A full-term newborn develops jaundice on the second day of life. Total bilirubin is 8 mg per deciliter and the baby is otherwise active and feeding well. What is the most likely diagnosis? Option A, physiological jaundice. Option B, pathological jaundice. Option C, breast milk jaundice. And option D is hemolytic disease of the newborn. We'll see first, hemolytic disease of the newborn. If it is hemolytic disease means it occurs, jaundice occurs within 24 hours only. But in our question, it occurs second day of life. Second day of life means after the 24 hours. And bilirubin level is 8 mg per deciliter is there. Okay, that's why we are removing the that option. Option D is also we are removing. Breast milk jaundice. Breast milk jaundice, it appears on 7th day or after 7 day it occurs. Our question asked second day of life. That's fine. Option C is also I'm eliminating. We'll see the pathological jaundice and physiological jaundice. Difference between the pathological and physiological jaundice. Physiological jaundice and pathological jaundice. Pathological jaundice. Physiological and pathological jaundice. In the physiological jaundice, it occurs after the 24 hours. It occurs after the 24 hours. But pathological jaundice, it occurs within the 24 hours. It occurs within the 24 hours. In the physiological jaundice, total bilirubin level be always less than 15 mg per deciliter. But in the pathological jaundice, more than 15 mg per deciliter. Always more than 50 mg per deciliter. And physiological jaundice, no treatment needed. No treatment needed. But pathological jaundice, treatment needed. Treatment needed. In the physiological jaundice, it's self-resolving. In the term babies, it will resolve in 7 to 10 days. 7 to 10 days. And in the preterm babies, it resolves 10 to 14 days. 10 to 14 days. Physiological jaundice, it caused by more RBCs in newborn. More RBC and decrease the lifespan of RBC. Lifespan, it's 80 days. Is compared to adults, the volume of RBC in newborns are 6 to 8 million will be present, and lifespan also it is it. That's why breakdown of RBC will be occur and jaundice will be appear. Another one is the immature liver. Another one cause is immature liver. Why means UDPGT enzyme which helps to converts unconjugated bilirubin into the conjugated bilirubin. In the newborns, liver is immature. That's why the amount of UDPGT enzyme will be low. That's why physiological jaundice will be occur. In the pathological jaundice caused by hemolytic diseases. Example: Rh incompatibility, ABO incompatibility, and G6PD deficiency. G6PD deficiency. G6PD is a enzyme which helps RBC to maturation. But in the pathology, because of the hemolytic disease, in the G6PD deficiency is there means RBC will be not proper maturing. Destruction of RBC will be occur. That's why jaundice will be occur in the babies. And another one is causes viral hepatitis. Viral hepatitis means it's difficult to convert unconjugated bilirubin into the conjugated bilirubin. That's why jaundice will be occur. And others are congenital obstruction in the bile duct. If bile duct obstruction is there means in the liver, bilirubin is converted conjugated to unconjugated to conjugated. But what happen? It will not drain the intestine. From the intestine it will go through urine and stool. It will go. Absorption it will go through the urine and the stool. But the bile duct obstruction present means it will not able to reach intestine. That's why unconjugated bilirubin level increase in our blood and jaundice will be occur. Congenital obstruction of bile duct. Obstruction of bile duct. Okay. We'll see. Now we will see the answer for our question. As per second day of life means it's definitely after the 24 hours. After the 24 hours, which jaundice will occur is physiological jaundice. Option A is the answer for our question. It is physiological jaundice. We'll see the next question. A 4-year-old presents with barking cough, inspiratory stridor, lateral neck X-ray shows steeple sign. Diagnosis. Option A, croup. Option B, epiglottitis. And option C, bacterial tracheitis. And option D is foreign body aspiration. We'll discuss about the croup. Croup is a syndrome. Its inflammation occurs in the respiratory tract. Whole respiratory tract inflammation occurs. Group of disease, which disease will be present means first we'll see acute epiglottitis. Acute epiglottitis. And second one is the acute epiglottitis, and second one is bacterial tracheitis. Not a tracheal, it's a bacterial tracheitis. Bacterial tracheitis. And third one is LTB. Laryngotracheal bronchitis. Laryngotracheal bronchitis. And the fourth one is in the group, the fourth one which is present, that is spasmodic laryngitis. Spasmodic laryngitis. Spasmodic laryngitis. The most dangerous is acute epiglottitis. Most dangerous. And the LTB, laryngotracheal bronchitis, is the most common. That's why if question asked group means you have to give the answer for LTB only. You think it's a LTB because of most common occurs laryngotracheal bronchitis only. That's why you have to give answer for LTB only. Okay. First we'll see the acute epiglottitis. Acute epiglottitis is caused by Haemophilus influenza type B bacterial infection. In the acute epiglottitis, infection and inflammation occurs in the epiglottis, and some assessment findings also we can able to find out in that epiglottitis. Epiglottis, which is held for during the eating, it will help for closing and opening of our windpipe, that is esophagus. We will see the 5D signs in the acute epiglottitis. Which are the 5D signs? I will show in front of you. First one is the if infection and inflammation occurs in the epiglottis means there is a difficulty to respiration also, because if swelling occurs in the epiglottis, it's little bit cover the trachea also. That's why breathing difficulty will occur. That's why first D is dyspnea, and second one is the difficulty in swallowing also. Difficulty in swallowing, that is dysphagia, and difficulty in talking, that is dysphonia. And another one is the if swelling is present in the epiglottis means there is a chances of drooling. That's why fourth day is drooling and the fifth day is distress. If we are not treated means within hours only it will take severe, it will go to the severe condition. That's why it will be distressed. The condition will be distressing by time, hour by hour means it called as a distress. The fifth one is the distress. First one is dyspnea, second one is dysphagia, third one is dysphonia, and the fourth one is distressed, and fifth one is the drooling. Okay, we'll see here. And the main important findings which is present in the acute epiglottis means in the x-ray we can able to see thumb sign. See here, this one is the thumb sign. It's present in acute epiglottitis. This one, thumb sign, we can able to observe in the acute epiglottitis lateral neck x-ray. We can observe thumb sign in acute epiglottitis. Acute epiglottitis. See here, another one x-ray is there in front of you. In the x-ray in the lateral neck you are observing this one structure like a stipple. In the our question asked for stipple sign. It is stipple sign present in croup or LTB, and croup is caused by parainfluenza virus. Caused by parainfluenza virus. Question arises from this only, and I will see the most common cause of the acute epiglottitis is the Haemophilus influenza type B, and here classical features of acute epiglottitis: dyspnea, dysphonia, dysphagia, and drooling and distress. In the X-ray finding, we will see the thumb sign, and because of infection epiglottis, it appears like cherry red appearance, and breathing difficulty will be present for our that to say completely and proper taking a breathing. The baby will take the tripod position. Tripod position, it is a classical features which present in the acute epiglottitis. And we have seen about the croup also. In the croup we'll see the stipple sign. It is caused by parainfluenza virus, and in the croup that hoarseness of voice will occur because of the swelling occurs in the vocal cords. In the vocal cords fall on, that's why the vibration, impaired vibration in the vocal cords, that's why hoarseness of voice and muffled voice we have seen in the group. Okay, and others are bacterial tracheitis and foreign body aspirates. It is a bacterial tracheitis. It is caused by the bacteria only, same Haemophilus influenza type B. Features there is no specific X-ray finding present in the bacterial tracheitis. In the foreign body aspiration, what will happen if the which foreign body aspirated, if it is a radio opaque means we will find out in the X-ray. If it is not radio opaque means we will not able to find out in the X-ray. That's the answer for our question is the option A. It is a croup or laryngotracheal bronchitis. We'll see the next question. A 6-year-old boy brought to the emergency department, fever and seizures. What is the most appropriate immediate treatment for control of seizures in the child? Option A, diazepam. Option A, fosphenytoin. Option C, valproate, and option D is ethosuximide. A 6-year-old boy in the emergency department having a fever and seizures also. What we'll call as in the children's most common seizure is the febrile seizures. We can diagnose it is a febrile seizures. Febrile seizures or GTCS, generalized tonic-clonic seizures. Appropriate immediate treatment for control the seizures. And the first choice, which drug will give for the control the seizures asked in the question. You'll see the first drug of choice in the case of febrile seizures is benzodiazepines. benzodiazepines are the drug of choice in the febrile seizures. Alternatively, if not respond, if IV access is not there, benzodiazepines will give the IV. If child is not getting IV access, means we will use alternative option, and that one is the diazepam. Diazepam will give the per rectal route, and another one is the midazolam. We can give intranasal sprays are available, we can give intranasal also. Alternative option for the benzodiazepines if we are not getting IV access. If then also this is the first line therapy, if seizures are not controlled, then what we can use? Second line we can use three drugs. First one is the phenytoin. Nowadays we are using fosphenytoin. Second one is the sodium valproate, and third one is the levetiracetam. These three drugs we will use to control the febrile seizure as a second line therapy. And another one important point, in the neonatal seizures, which one is the drug of choice in the neonatal seizures? Drug of choice are phenobarbitons. Are the drug of choice in case of the febrile seizures in the neonates. See the answer for our question. First answer for our question is the diazepam. First choice answer for our question is A, that is diazepam. We can give phosphate and valproate also, but it's a second line therapy. First we will give the benzodiazepines. In that, diazepam is present in the option. That's why we choose the option A. And option D is, what is this? Ethosuximide. Ethosuximide will use in the absence seizures. Will use, or also called as petit mal seizures. Ethosuximide will use. Other MCQs will discuss in the next session. Thank you so much.